Having looked at what is the definition of depression and the signs and symptoms of depression, we now ask ourselves, what causes depression? And depression can either be caused by biological factors, psychological factors, or socio-environmental factors. And most of the time, these factors combine. When I talk about biological factors, what do I mean? Some of the biological causes of depression, number one, includes the brain chemicals. Brain chemicals, we know that our brain is controlled by chemicals called neurotransmitters. And in depression, either the serotonin and the dopamine neurotransmitters are affected. So brain chemicals get affected, they dip, and then your mood dips. Number two is your genetic predisposition. We know that depression sometimes runs in the family. There's a genetic predisposition to depression, especially among the women. You find your grandmother had it, your mother had it, and you have it. So sometimes, but it does not mean that because people in your family have had depression, that you're also going to develop depression. But then if you undergo stressful life events, then you can have depression. So genetics. Hormonal changes, and that's why I said I'm going to discuss about depression in women. Hormones play a factor in women depression, including the changes that happens during pregnancy, childbirth, menopause, and even during the menses. Medical conditions, there are some medical conditions that brings about depression, and once you manage that medical condition, the depression also goes. And this one includes things like hypothyroidism, heart diseases, cancers, and also Parkinsonism. When you look at some of the psychological factors that contribute to depression, number one is your personality trait. What kind of a person are you? There are people who have low self-esteem, self-criticism, pessimism. They're always negative, and they get easily overwhelmed. If you have such traits, then you can easily get depression. Trauma, especially trauma that happens in early childhood, especially the traumatic events of abuse or even losing a parent. Mental illnesses, there are mental illnesses that predisposes you more to depression, like the anxiety disorders, the eating disorder, bipolar mood disorder, and many others. So mental illness is part of the psychological factors. When you look at the socio-environmental factors which contribute a lot to depression, number one include stressful life events, bereavement, divorce, separation, financial stresses. If those stressful life events can contribute to depression. Chronic illnesses, having chronic illness that is lasting for long. You see, pain is not supposed to last. But if you have something that is causing pain throughout, cancer, heart disease, diabetes, hypertension, arthritis, chronic diseases can predispose one to having depression. Of course, abuse, especially either physical, sexual, emotional, any kind of abuse to a human being can predispose someone to depression. Substance use by itself is a predisposition what can cause depression, especially using things like cannabis, which when you're not using, and most of the substances when you're withdrawing, they present with altered moods, and most of it is low mood. So substance use also can predispose one. And we know that those people who are genetically predisposed, most of the time they are able to go through their life without exhibiting the genes of depression. But then when you use substance or you go through a stressful life event, then you might have depression. Social isolation. Having no social support, having no people around you. And now we are seeing social isolation, not because there are no people around you. We are having social isolation because of the phone usage. People are more on their phones than interacting with the people around them. So you're there with people, but you're lonely. You're not interacting with people. So social isolation, either because of lack of support around you or getting lost in the gadgets that you might be using. Most of the time, these factors cause depression when they happen in a combination. It's not one. Most of the time they interact, and a good example, you might lose a partner or you might divorce your partner, which then makes you feel sad, which makes you keep away from friends. and that keeping away social isolation might predispose you to using substances. Or you might be genetically be predisposed. Then you go through a stressful event. So depression, the causative factors of depression, they always act, most of the time they play part together. So I've said biological causes, I've said psychological causes, and also I've said the social environmental causes. And most of the time they act in combination. Next, I'll just discuss about depression in women, because I said depression is more common in women than